Hi, how are you? Okay, so right now, uh, as it comes to, in regards to find the answer to cancer, the hashtag, uh, that is my hashtag. And I have a page, Purple Scarlet Topaz, on Facebook, if you'd like to go there and follow. Uh, some things are about cancer, and then, of course, I do everything else, okay? But uh, I'd like to see, because I see that the standard of care when it comes to the treatment of cancer is not adequate. And I don't know how many other people feel that way, but I see that it's not. And so I would say that we need to see uh, other treatments that are basically not on the table, put on the table. We need more treatments on the table, okay? And I believe that each individual case with cancer should be treated as such, okay? I come across a lot of things that talk about trials and study. They've discovered that this thing does this to cancer and that does that, and these different things, but yet it has not become a way or an option. Okay, it still doesn't matter if you go to the hospital right now and you have cancer. The options for you are basically going to be the same. Surgery, okay, it usually comes down to some surgery and then rounds of chemotherapy. And then they may want to say, oh, well, the chemo isn't working. Let's try immunotherapy, okay? Well, why didn't you try immunotherapy first? Okay, because then with certain immunotherapies, it's supposed to do something. They can give you something that sort of boost the the immune system, certain cells in the immune system to fight the cancer. But why didn't you do that in the first place? Okay, you understand what I'm saying? It doesn't make sense, because then the body has, from chemotherapy, the body has become damaged just from the chemotherapy, not even just the cancer. Okay, so then you want to tell someone, oh, let's try immunotherapy after you've damaged them in the first place from the chemotherapy and the cancer. Okay, so, and when I think about different diseases or viruses like HIV and AIDS, think about how many people died. How many people died from HIV and from AIDS? Meanwhile, people are dying, okay? Meanwhile, they're studying and they have these treatments that they think will work. They've done different things, but they have to go through the trials and the clinical studies and da 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 da. Okay? How many people died while they were doing that? Now, I understand that, you can't just put out medicine, oh, look, this, and just throw it out there. But does it have to take so long? Does it have to take so long? Okay? Does it have to take so long? I think not. How many people could have been saved that had HIV or that had AIDS, that could have benefited, from some of the medicines that they had come up with, that they were studying and trialing and going over it with peer checking and all of that. How many people could have been saved? Okay, and the same thing goes with cancer. Okay, they have this thing that, I've seen that they're saying something from the bees can cure the breast cancer, or I've seen a lot of different things that they're finding. But I'm like, okay, when are you going to put this into action? Okay, how long do people have to wait? And why do they have to wait? Okay, so once again, when we look at the vaccine for the COVID-19, okay, it didn't take them long to come up with that vaccine. Okay, now, it didn't take them long at all. And they were throwing it out to everybody for free. Okay, and I understand, excuse me, I understand that if the situation maybe wasn't so dire, okay, people were just dying all over the world, I could see, that it's possible that they maybe could have come up with a better vaccine if time allowed. You understand? If it wasn't so dire, maybe it wouldn't have taken 9 months for them to come up with a vaccine. Maybe it would have taken them 2 years. But you see what I'm saying? So the thing is, we need people with cancer patients need to have the options on the table. Okay, all options are on the table. Okay, even if something isn't fully, it hasn't gone through the whole process that they make it go through, and look how long it takes before they can get to the FDA approval. Okay, but if it's going to help people, and you can tell the people the risks, that it hasn't been around long, whatever, the treatment, this is a possible treatment, and you can tell them why it's a possible treatment, and let them decide, plain and simple. Okay, everything has risks, okay, but those risks, the options to do something besides chemotherapy should be on the table. Okay, they should be able to pick what they feel is best for them, of course under their doctor's guidance. It should not have to be chemical therapy. Okay, the standard of care must change. It must. And it has to be done soon. It needs to be done sooner. Okay, this thing of taking too long, taking all these years before you put out a medicine that will help someone's life when they have disease, it should not take years and years and years, especially when there are people that are dying. Okay, it shouldn't take years and years and years. What we see with these new medicines that they have for HIV, that's really great. It's really a wonderful thing. It's a blessing. But when I see that, I also think of the people that could have benefited from it. I think about the people that were dying because they didn't get that medicine, because the medicine had to wait for FDA approval, or had to wait for this or wait for that. But, with this pandemic, we saw a lot of things were, what do you call it, were for emergency use. Okay, so if there's a treatment out there, then and okay, it doesn't have the full FDA approval and blah blah blah, then why can't it be used as emergency use? Why not? Okay, why can't we do more of that? Okay, designated for emergency use, or because the patient would rather try that. Why not try some of these new treatments, okay? And then if they don't work, then you can, go to chemotherapy as a last resort. Chemotherapy should not be the first resort. It should be the last resort. Okay, they've got it all backwards. Okay, but like I said, they're making so much money off of it. They like it just the way it is. Okay, so that's what I have to say about that. We should see, there should be a push. You doctors, you oncologists, you non-profit organizations, what do you have to say about this? Okay, what are you doing as doctors, as, like I said, non-profits, all these cancer non-profits? What are you doing in pushing for better care for cancer patients, or even with the standard of care? Don't you see that these people are dying from cancer even after they get the chemotherapy treatments? Some of them might be dying faster. I don't know. I believe that they are. Okay, because the therapy makes them so sick, and like I said, it doesn't just affect the cancer, it affects their whole body. And so I would like to see some of these non-profit cancer societies and foundations, I would like to see them do more. Okay, because I know that when my mother was sick and she had cancer, I called a couple of these of the foundations and and societies for cancer, this and that, and I couldn't tell what they did except collect money. Okay, all I see that they do is collect money. Who does that money go to? It doesn't go to the people. I don't see that they give to people that are going through cancer treatment. When women have breast cancer, I don't see them stepping in and doing anything for someone that has the breast cancer. Okay? I mean, all I see is that they have runs, running for cancer, uh, with the pink ribbons, but I don't see that you're really doing anything for someone when they have any kind of cancer, except cancer awareness. We are aware. We are already aware, okay, about the cancer, but I don't see you doing anything. The only one I can say that I can see really does anything when it comes to helping and giving and supporting cancer patients is St. Jude's. Okay? St. Jude's. Yes, I believe that they do the most. Okay? At least when it comes to children, they do the most. The rest of them, I don't know what they do. All I see is, they collect money. And I don't know what they use it for. I mean, I guess they use it for their commercials. When they ask you, could you please send $19 a month? Or, give to this. I don't see anything that is really being done except that it's supporting, I guess a person has a job, but I don't see that they're really doing anything. Okay, we're already aware of cancers. We are aware of breast cancer. We are aware of, all of that stuff. We are aware, okay? But awareness, you just telling me you're making awareness, you're building awareness is not enough, okay? Maybe you can add, I don't know, what is that word? Add, advocating for more treatments to be on the table. Maybe you can advocate more for changing the standard of care, individualizing the way, the treatment, okay? Individualized treatment for cancer, okay? Maybe you can do that. That would be nice, okay? So, thank you for your time, and I'll talk to you again. Take care.